Hi, everybody. I am Shelley Collins. I work with Muskogee Creek Nation Dental Clinic. I'm the hygienist for the clinic in Eufaula. And this year, I am going to talk to you about oral health and being diabetic and how important it is to have a good relationship and a healthy mouth while you're diabetic. So the first category we're going to talk about is gum disease. And gum disease can be categorized into two branches, gingivitis and periodontitis. And I will talk to you about both of those and go into depth about each one. So when you come into the dental office, we look at your mouth, and this is a picture of a healthy mouth. You can see the gum tissue is nice and pink. There's no redness, there's no buildup on the teeth. We don't see any bleeding, and this is pretty much considered a healthy mouth. So when we get into talking about gum disease, we're gonna talk about gingivitis. As you can see, this is a total different picture from the first one. The gum tissue's red around the teeth here. These teeth here look like they have a coating on them. The next picture, figure 4, you can see a red margin around the gums here. And so that signals inflammation of the gum tissue. Gingivitis involves the gums only. So let's talk about what gingivitis is. Gingivitis is a form of gum disease that causes inflammation, redness, and bleeding of the gums. Some causes of gingivitis: plaque. That's the white sticky film you brush off your teeth every day. That is formed by bacteria. So bacteria deposits that on your teeth, and that's why it's important to brush and floss every day. Poor home care causes gingivitis. Again, not brushing twice a day and not flossing. And brushing is so important to remove the plaque because you remove it from the front, the back, and the chewing surfaces of the teeth. And then you go back and floss. Your toothbrush cannot reach in between the gums. So brushing and flossing is a partnership, and you can't do one without the other and have a healthy mouth. The next category, periodontitis. This disease involves the bone. So this picture, you can see this patient has a lot more going on. The gum tissue is really red. It looks like if you were to touch that, they'd bleed. You can see some deposits on the teeth. Figure 6, the next picture, this person doesn't have a whole lot of buildup on their teeth, but you can see they look really long. And that's because periodontitis or periodontal disease has destroyed the bone and the gums. These teeth are probably loose here in this picture. So let's talk about, I have another figure here. This person has deposits on their teeth, and you can see how the gum tissue is super red. It looks like it's been pushed down. The figure 8, the buildup on the back side of these teeth has pushed the buildup down, has pushed the gums down. Most of the time, people have this buildup on the back side of the teeth. That's normal, but this person here probably hasn't had their teeth cleaned in a while, so that buildup just keeps building up and building up and building up there and causing destruction. All right, so let's talk about periodontitis. A lot of people say pyorrhea. That's an older term. So essentially it's the same thing. It's not hereditary. You can't contract it from somebody else. Or it can't be passed down from anybody. Some causes are untreated gingivitis. So having gingivitis and not treating it will lead into periodontitis because the plaque, the bacteria deposits, hardens, and that's that buildup you see on the teeth. And with that, bacteria is able to mutate, and it's more resilient, it's harder to get rid of, it lives under the gums, it doesn't need air to breathe, so it's a little bit more invasive than just your bacteria associated with gingivitis. And so with the bacteria and your body, your host response, they kind of butt heads, and so they're able to actually destroy the bone around the teeth. That's why periodontitis destroys the bone. This is a picture, an X-ray. You can see in the circled portion, the white buildup inside there. If I were to look at that patient visually, I would never be able to see that. All this buildup here is underneath the gum tissue. So when you come in and you have X-rays, we can see that and we can let you know what you have going on underneath the gums. So treatment, let's talk about what do we do for these categories of gum disease. So for gingivitis, come in, get a dental checkup, get your teeth cleaned every 4 to 6 months. It depends on your case. And then when you come in, I'm going to talk to you about how to brush your teeth, flossing daily, what other things you can add into your routine that'll help you have a healthy mouth. A few facts about gingivitis. So gingivitis is kind of like you get a second chance. It's a reversible disease. It only affects the gum tissues. There's no bone loss associated. So I'm going to say you got gingivitis. I'm going to say, okay, let's get in here. Let's do your homework. Brush twice a day, floss daily. You can totally turn that around into a healthy mouth. For periodontitis, since it affects the bones, it's a little bit more of a treatment. You have to have a deep cleaning. A lot of times you get numb. I'll give you a shot in the mouth. Go under the gums. Remove all that buildup you saw on the X-ray. Not all the time. You don't have to get numb. It's more comfortable. And when I remove that buildup and toxins under there, that helps the gum tissue heal. So it's like having a wound there that you're just cleaning really good. A few facts. Periodontal disease is not reversible. The bone loss is permanent. And unlike that slide I showed you with the teeth that looked really long, your gums and bone won't grow back. So after you have a deep cleaning, you have to come in more often, every 3 to 4 months, because that bacteria will get all the way back down in the pocket and re-affect you again. And so it's like starting all over. So coming in, getting your teeth clean, you staying on your home care is the best way you're going to maintain periodontal disease. All right, so let's tie into diabetes with oral health here. How can diabetes affect my mouth? The link between diabetes and oral health is high blood sugar or glucose. Glucose is digested by the body from carbohydrates and starches, what we eat. It is a vital source of energy and it's carried throughout the bloodstream. So when you have high blood sugar, it can actually weaken your body's white blood cells. And we all know that's important for fighting infection. And that is the reason why people who are diabetic tend to heal a lot more slow when you have a wound. Glucose or sugar is presented in your saliva. So when you have out of control blood sugar, you have a high risk of getting cavities because bacteria feeds off those carbohydrates and starches and deposits that plaque. So when you have a lot of plaque in the mouth, that puts you at risk for getting cavities. And along with a lot of plaque and sugar, that brings the pH down in the mouth and it becomes acidic. So anytime your mouth's overly sugary, it brings the pH down and it becomes really acidic, and it's targeted, allowing bacteria to actually break your tooth down into a cavity. And then it just helps the harmful bacteria grow, high blood sugar. And then kind of just recap, high blood sugar equals an increase of plaque. And I'll go in further detail when we start talking about cavities, how that happens as well. Okay, so here's a picture of a person who has a lot of decay. This is very painful to somebody. This person has lost several of their teeth. You can only see the roots left. It's just really severe case of somebody who has decay. So how does this happen? All right, so again, you got out of control blood sugar. Bacteria is feeding on that. It's releasing plaque. It's able to inflame your gums, create buildup. It turns into a different type of bacteria. Boom. That's how gum disease develops. A few signs of that are red gums, swollen gums, gums that bleed easily, gums that pull away from the teeth. Like I showed you, they look long. Sometimes the teeth are loose. You can have bad breath or a bad taste. I coined it the silent killer because just like in that X-ray, people come in and go, no, I'm fine, nothing hurts, don't have any bleeding. I show them the X-ray and they're completely blown away because a lot of times that's not bothersome. So you would really never know until you can see inside the teeth and underneath the gums there. This next section, we're going to talk about some complications from diabetes in your oral health. Gum disease, sweat, pus, pain, red or white patches on your gums, tongue, cheeks, or roof of the mouth. That's an infection. All gum disease, cavities are all seen as infections in your mouth. And how that happens is, so your blood carries nutrients and oxygen to the teeth. And so when your blood vessels are narrowed, if your blood sugar is out of control, the body's not able to transport those nutrients and vitamins and oxygen to wounds. So if you have a wound in your mouth, a lot of times that's why you heal slow. Your blood can't carry those essential nutrients to the wound, and it causes the body to not be able to heal right. Another form of infection, an abscess, which is a collection of pus on the tissues. So how that happens is we've got out of control blood sugar. We've got an increased amount of plaque. It's brought the mouth down to be acidic. And now the bacteria is eating holes in your teeth and causing decay. And so when you don't treat the decay, that leads into an abscess. And some pictures of an abscess on the outside of the gums look like that. A lot of people say it looks like a pimple, which it kind of does, and you can see the pus in there. This is an abscess on an X-ray. You can tell the dark circle around the roots of these teeth here. All right, we're going to jump to another complication from diabetes, xerostomia, meaning dry mouth. A lot of times that's caused by high blood sugar levels in medication. Some signs of that: dry feeling, tongue feels rough and dry. You've got this pain in your mouth that's not coming from your teeth, cracked lips, mouth sores that develop, and problems eating, chewing, and swallowing. So one of the main functions of saliva is to help break your food down. It's got enzymes in it. So while you're got something in your mouth, your brain tells your saliva glands to start working so you can swallow good. So people who have dry mouth may get choked really easily. And this is a picture of a tongue. You can definitely tell how dry it is. It's got a lot of cracks in it. So that's just an example there. The next category is candidiasis or thrush, which is naturally in the body, but it can get out of control when your mouth, when your diabetes is out of control. Some signs of that are sore, white, or red patches on your gum, your tongue, your cheeks, or the roof of your mouth. And main causes are denture or medications and dentures. And I'll talk about the denture part here in a few slides over. This person has thrush on the tongue. A lot of times you see that in babies a lot, but you also see that in adults and in people with diabetes. This person here wears a denture. I can almost see the outline of the denture. They probably never take that out. You can see how red the gums are. Something you can barely see. There's a few bubbles on there. That's just an overgrowth. That's basically a yeast infection up under a denture. White patch on the roof of the mouth in this slide. The next complication is burning mouth. A lot of people experience this, and it's caused by uncontrolled blood sugar levels. And a lot of times you have a burning mouth feeling, a dry mouth, a bitter taste, and throughout the day that burning just gets worse. And so that's just an unknown thing about being diabetic and having burning mouth. They really don't know what causes that. Okay, so now we're going to talk about prevention and treatment of these oral complications. For gingivitis, we kind of already touched up on that, but again, brushing twice a day, flossing daily, coming in, getting checkups and cleanings are going to help prevent that. For the periodontitis, I talked about a deep cleaning. Sometimes there's an antibiotic we can prescribe depending on the case, and a mouthwash a prescription mouthwash that we can prescribe as well. And then in a severe case, sometimes you need gum surgery. So for cavities and abscesses, to prevent those, lower your sugar intake. Energy drinks are terrible for you. Just in general, they're terrible for your body. They're terrible for your oral health. Candy, if you people who have dry mouth, if you've got Put some candy in your mouth. Always make sure it's sugar-free or xylitol. Xylitol actually kills bacteria, so that's good to use. And then lower your sweets intake as well. Brush twice a day and floss daily. You can't stress that enough. And then come in and have your regular dental checkups. For xerostomia, I kind of touched up on that. Dry mouthwash, sugar-free candy, rinsing with a fluoride mouthwash. You can get most of these things, all of those things over the counter, and just depending, we can recommend a few brands that you can try to see what helps you the most. Do drink a lot of water. That helps hydrate the tissues. And then avoid tobacco, caffeine, and alcoholic beverages. All those just enhance the dryness. For the candidiasis or the thrush, there's the medicine our dentist can prescribe to help kill that. And then clean your dentures. So that's so important because if you wear your dentures all day, you never take them out. It's like wearing a wet sock, and bacteria develops under there. So that yeast is able just to take control. Taking your dentures out, cleaning them, they have tablets, they have different rinses you can use, will definitely help control that. And then because your gums are a tissue, they have to breathe. For the burning, you can see if your doctor can change your medication, but a lot of times when your sugar's under control, that burning goes away. All right, so some facts about being diabetic and diabetes. Your resistance to infection is decreased, and we talked about that. Oral disease, dental cavities, and periodontal disease are all considered a type of oral infection. You heal a little bit more poorly. The higher your blood sugar is it goes up, and then longer it's out of control, the cavity goes up in cavity rate because of the sugar in the saliva. And diabetes in a mother-to-be has increased potential to have a child whose teeth are affected. So even though children usually are not born with teeth, they're developing while they're in the womb. And so out of control blood sugar is actually able to create some problems with your unborn child. And if your blood sugar is out of control, a lot of times those dental infections can cause your blood sugar to go out of whack. And unless there's an emergency, a lot of times dental treatment shouldn't be done until your blood sugar is under control, just because we don't want any kind of medical emergency to happen while you're here in the chair, and we want good results with your treatment. Okay, so I have a lot of patients that say, what if I don't have any teeth, or what if I have 2 teeth? It's still important to come in. People who are diabetic and missing all of their teeth or have very few teeth are still in need of a dental screening and a yearly exam and cleaning. How come? Well, when you come in, we'll do Xrays. We always do an oral cancer screening. For those who have very few teeth, a full mouth of teeth, 1 tooth, we'll do a periodontal screening. We'll do cavity detection, and that just helps let us know that what's going on. So for people who wear dentures or maybe have 1 tooth, it's so important to have Xrays. This person in the slide here maybe has a tooth there, maybe doesn't, but they've got something going on in the bone here. This circle here is not normal. You would never be able to see that unless we had an X-ray. Whether that's cancer or whether that's a cyst, you never know. It's so important to come in and let us at least take an initial X-ray and then a follow-up every 3 to 5 years there for this type of X-ray. This is oral cancer on the side of the tongue. The most common place is on the tongue, underneath the tongue. This looks like nothing. But it actually is squamous cell carcinoma, cancer. Oral cancer is high on the rise, and it's very, very sneaky. And it affects everybody across the border, no matter your age, no matter your social status, anything. It affects everybody. All right, so what's next? Make sure you schedule an appointment with the dental clinic. The screening usually is an initial step. You come in, usually you'll see me. I'll look at the teeth. We won't take X-rays because it's just a really quick glance. I'll kind of assess your gum state at that time, and then we'll get you back and get you a dental cleaning and an exam. Sometimes they're the same day, sometimes they're not. Strive for good home care. Even though you may not be in the habit, or even if you have gum disease, it's still important to try to get in that habit of brushing twice a day and flossing, because that's only going to help you once everything's nice and clean and the bacteria is disrupted, to keep going on with that. Take your medicine every day, eat a healthy snack before you come in, and strive for a healthy diet. Check those blood sugar levels every day. In our clinic, Dr. Forrester, Dr. Hammer, Dr. Beaver, we all want to know what's your blood sugar level, what's your A1C, because that's important. If it's out of control, that's just going to affect the treatment that we can do on you. So definitely know that. And then maintain your diabetic yearly appointments every year with your diabetic clinic. And that ends the presentation. Thank you so much for listening. I hope that you were able to take something back with you from this presentation. If you have any questions, don't hesitate to contact me. I work at the Eufaula Clinic in the dental department. Thank you.